Good morning, respected professors and my dear colleagues. I am Dr. Ruxana. I am here to study on prevalence of primary glaucoma in patients attending ophthalmology OPD. I have no financial disclosure or conflicts of interest. Glaucoma is the second leading cause of blindness in the world and responsible for 10% blindness in the world. An estimated population of 67 million people are affected worldwide. Glaucoma is a progressive optic neuropathy with characteristic optic disc cupping and corresponding visual field defects with or without rise of intraocular pressure. The main aim is to evaluate different prevalence patterns of primary glaucomas in tertiary care hospital. This is a prospective case study and the sample size is 30. All patients underwent a comprehensive eye examination in a hospital which included visual acuity, slit lamp biomicroscopy, IOP measurement, gonioscopy, dilated fundus examination, and perimetry in selected cases using Humphrey Visual Field Analyzer. Inclusion criteria: all adults in the age group from 40 to 80 years were included in the study. Both male and female were included in the study. Exclusion criteria: all adults less than 40 years, more than 80 years were excluded. Patients uncooperative for diagnostic evaluation procedures were excluded. All secondary glaucomas were excluded. This is a demographic profile. The prevalence of primary glaucoma was more in the age group of 61 to 70 with prevalence rate 50%. And males are more commonly affected when compared to the females with prevalence rate 60% and 40% respectively. And 27% of people has hypertension as a risk factor. 40% of people has thin CCT as a risk factor. 23% of people has diabetes mellitus as a risk factor. And 10% of people have family history as a risk factor. So overall, thin CCT is a major risk factor for primary glaucomas in my study. Prevalence of vertical cup disc ratio in primary glaucomas. Greater than 0.6 cup disc ratio is seen in 87% of people and less than 0.6 is seen in 13% of people. Visual field changes. 40% people have superior arcade scotoma and 10% people have inferior arcade scotoma and 7% people have paracentral scotoma and 7% people have double arcade scotoma and remaining 36% patients are not cooperative. The prevalence of primary open angle glaucoma is more when compared to the PSEG with prevalence at 73%. A total of 30 individuals were examined. Mean age of patient was 40 to 80 years. POAG was found in 22 patients and PSEG was found in 8 patients. The prevalence of POAG was 73.4% and PSEG is 26.6%. The prevalence of glaucoma was significantly higher in men than women. The prevalence of glaucoma was highest among 61 to 80 years age group. In this study, hypertension, diabetes mellitus, family history and thin CCT were significant risk factors. Glaucoma usually asymptomatic. Patients often present late in the course of the disease with irreversible damage. According to Baltimore Eye Survey, prevalence of glaucoma increases with age. A positive correlation between glaucoma and diabetes was shown by Beaver Dam Eye Study, Los Angeles Latino Eye Study and Blue Mountain Eye Study. A positive correlation between glaucoma and hypertension was shown by Baltimore Eye Study. A positive correlation between family history and POIG was shown by Baltimore Eye Survey. These studies are in accordance with our present study. In this study, prevalence of POIG was 73.4% and PSEG was 26.6%. Conclusion: the prevalence of POIG was more than PSEG in this study. In this study, older age, history of hypertension, diabetes and family history and thin CCT were significant risk factors for POIG. As glaucoma results in irreversible damage, early diagnosis, evaluation of risk factors, prompt treatment and regular follow-ups are very important to prevent further damage. These are the references. Thank you.
Thank you. So did you find anything different in your study? I mean, which we already know about the prevalence of open angle glaucoma?
Actually, thin CCT, not much difference, ma'am.
The same?
Actually, same.
Okay, fine. Thank you.